I just talked to John, and he's willing to stay through the wrap-up. So I'll start off by posing a question to him, but also to all of you. As John said, put on your thinking caps and envision a future where we're all coming together again in 2030. And outside of talking about my new walker,
Science. Remember, keep it in
science.
science.
Yeah. What are we going to be talking about in regard to these goals in 2030? John, what do you think we're going to be?
Great question. As a general philosophy, I try not to engage in too many predictions because I think that leads to too much presumption of fait accompli. It's just a starting point. So I think there are some things that are mega trends that are tough to deny, like China's role in the world we know is going to be huge, and there are some things that are structural. But I think most things are balancing acts and can go any way. And I think it's often better to treat them as actionable items that need to be confronted rather than things that need to be absorbed unless they really do. So we have many, many things like in 2030, there are categories of things like if something blows up physically, heaven forbid. These are risks that the world deals with day to day that will change how we might talk about things. There are many things where I would presume the technology, I am guessing we will have some technology breakthroughs between now and 2030 that a handful of people in a handful of labs and companies are thinking about that none of us have thought of. So think of this in 2000. We just wasn't in our brains. And so there will be versions of this in 2030, whether it's the self-driving cars, whether it's the new energy system, whether someone figures out battery storage of energy, I don't know, whether it's the prosthetics generation, whether it's, who knows? But I think the role of science and nonlinear breakthroughs in science is crucial, so we just have to think about that. I think a huge thing we have to be navigating is, I'm sorry, I don't know how to control my iPhone because it's still too new to me. But I think we'll be navigating things like information, privacy, I think medical records, I think, but even the hyperconnectivity of data systems, we don't even have protocols for dealing with it. And this is going to be major when it comes to biomedical research and anything around lifetime exposure to various forms of risk, whether it's personal risk or physical or epidemic risk or pandemic risk. The forms of personalized medicine have a flip side at every stage. And personalized well-being, not just medicine, have a flip side at every stage. I think what I hope, to give a direct answer finally to your question, I hope we are talking about the transition from the end of extreme poverty in its many forms to the notion of resilient societies in all forms. And that means resilient on the lifelong basis, and it means resilient on an environmental basis, and it means resilient on a cooperative basis, I hope.
Thank you. And just to give some perspective, from the day we began, a couple days ago, we've been talking about the goals in 2030. It's only 14 years. A child born today won't even be in middle school in 2030. So we're not talking decades. It's just around the corner, especially if you're young. Folks like Louise will be in mid-career in 2030.
Can I say one thing on that? Mm-hmm. So not to interrupt, but I think the big thing about 15 years is it's far enough away to push us out of our own current mindset, but close enough that it can be actionable. So 15 years ago, there was no global fund to fight HCV malaria. There was no advanced market commitment for vaccine innovations and all these things. There was gay marriage was seen as impossible. From the institutional to the scientific to the values-based, you see these very rapid changes. So it's far enough away that we can say, okay, what's a presumption or assumption I have about the world that could be changed within that time horizon? And what does that allow us to do?
So with that, the floor is open. Your thoughts about where we're headed, what we need to do, what you'd like to see the forum do. This is wrap up and an open floor.
I guess,
Valerie and then
oh,
Tom.
I'm sorry. Just in terms of following up on that thought, we've been talking about it a little bit over the last couple of days, but I guess I wonder what were the drivers of these really significant changes, and what were the kind of linchpins, I guess, if you will, for lack of a better term, that happened over the last 15 years that brought us to the point of being able to actualize some of those changes, and what can we learn from that with the SDGs? Are those drivers still applicable? How do we make them more relevant to the work that we're now doing, so that we can achieve some tangible outcomes?
Should maybe take a couple, or do you want me to do one at a time? I'll do that.
More,
Whatever you want.
go ahead, Tom.
It's a great question.
Well, just thinking 15 years ahead, just not taking on the whole thing, but just thinking about violence, I sort of shorthand would be optimistic about Latin America and really concerned about Africa. And I suspect that a lot of I think the measurement is so bad in Africa that there actually may be huge problems in Africa that aren't even being properly measured at this point. But I guess, John, my question to you is, I think it's a huge leap. We've all been talking about it. It's a huge leap forward for the issue of violence and security and justice to be included. But how do we make sure that that is not one of the the Millennium Development Goals that just didn't get acted on? Now that we're in the conversation, how do we make sure that we remain part of the conversation and that we are not, the goal that gets left behind?
Well, maybe I could try to start from the end, and that'll answer a little bit of your question. My simplest answer is that's for you to figure out as a community.
You need to do better.
You're welcome. You're welcome. No. But my more drawn out answer is, so why that's the simple answer is, the way I think about these goals is it gets back to sort of an agenda of agendas. The metaphor I have in mind is that the world needs to have a 17-room conference center where each of these specialist communities, I'm speaking semi-metaphorically here, but there are really 17 different epistemic communities in these things. And each needs to figure out how to organize around its agenda, including needs, policies, resources, institutions, and scale, with specificity and scale as the two key words for every question. Now, each group has to then think through, I'm going to mix metaphors now, pretend you're in a football game, how to get a first down every year. Some groups are starting at their own goal line. Some groups are starting at midfield. Some groups are actually starting pretty close to the other touchdown line. So global health has actually spent around disease control since 1996 now, 20 years getting organized. Concepts, institutions, academic communities. And so they're actually very well wired. There's a whole global health strategy between WHO, all the global health agencies are kind of collaborative. And then the academic community is collaborative. They've got their bullseyes on what they're watching in these institutions. There's the base science and everything, bench science taking shape. It's all a pretty healthy, imperfect, anyone in that world can tell you what's wrong with it, but relatively speaking, it's a pretty healthy ecosystem of players that's kind of upgrading and upgrading and upgrading. There are some groups, I would argue, my favorite example is oceans, which doesn't have that fully interactive ecosystem because we don't have any real global institutions mandated with managing the oceans. We have a scientific community with lots of great lots of great leaders. We have a mutual friend of Lisa and mine, Enrique Sala, is like leading this whole pristine seas effort. They're getting one place at a time. They're literally just going one place at a time now to restore or protect ecosystems. They just worked with the president of Ecuador to get Galapagos protected. As a footnote, if you had to guess how much of Galapagos marine areas has been protected, what would you guess? It's been 1% protected. Wow. Galapagos. And they had an agreement to climb to a third. And there's all sorts of words around what's protected, but I'm giving you the bottom line. It was 1%, now it's going up to a third. So just think of the rest of the oceans. So that's a reflection of how the system has been working. And I have theories myself, hypotheses as to why different professional communities have different abilities to think about scale. In my view, it comes down to the unit of analysis of the community and how people are trained in their academic departments. Physicians and epidemiologists are trained to think about life and death. Economists are trained to think about the marginal use of the next dollar. It's actually a very deeply different question. So I say that because for the violence community, I think there are some parts of this in this traditional security sense that are, consider themselves deeply organized on this. There are some parts that probably have been grappling for how do we deal with this, and I would say there's the more behavioral aspects, which is how I'm interpreting a lot of this conversation, fairly or not, which are, in a sense, totally fresh. And so it needs to think through how can we organize similarly between science, institutions, leadership by example, partnerships, and policy. Now, just because we have a 17-room conference center doesn't mean there's no plenary. And so the magic of the SDGs is when the 17 rooms come together in plenary, report back on their common outcomes, say, we're at the 10-yard line now, we're at the 40-yard line now, just so others can understand where we are in our problem-solving process, and take on common challenges like, we all need to do better on data benchmarking. We know that's a crucial thing across pretty much every goal at the outset. Now, the real magic, like any conference, comes during the coffee breaks. Or at the bar at night, depending on which conference. But when the informal interactions across disciplines and communities that are about people finding new ways where the sparks fly. That is where I think the violence community probably needs to spend time swimming in the water of different influencing communities to say, how could we create those new forms of entry point for what matters to you? So the single biggest question I would ask you is, who do you think are the 3 most important actors in the world to solve your problem? How do they think? Where do they meet? What are their sources of influence? Which ones would be surprising? Which ones would change politics? Which ones bring resources? And how could you work with them so they're part of a solution? And this is my long answer to where you saw the breakthroughs. Where we saw the breakthroughs was all these things. And I think when we think about the possible change, I actually think, I'm Canadian. In Canada, 2 things give me great hope on this agenda. And I see you, but just to share this. One is First Nations discussions. So yesterday, I was in extraordinary Wabano Center in Ottawa, which is a First Nations health service center, which literally is designed with extraordinary art as a notion of life is beautiful and people are beautiful, but also has traditional Western medicine in the same clinic as, Western medicine alongside traditional medicine. So they're actually interactive forms of medicine. It's extraordinary, serving 10,000 people in downtown Ottawa. And it was so striking to me, and for those of you who know a bit about Canadian First Nations issues, there's a whole truth and reconciliation process underway about the travesties of what's happened there. But the way in which people are thinking fresh about tackling very old problems is actually quite inspiring. And similarly, there's a mental health effort underway where in Washington at the spring meetings of the World Bank and the IMF, the finance minister of Canada, Bill Morneau, made a major speech on mental health.
The SDGs. I mean, substance abuse is mentioned by name. Mental health is not.
I can't tell you that history. You'd have to ask the health community. No, I can't tell. But I don't. But in a sense, you have to think of these SDGs not as straitjackets. You have to think of them as a toolkit. Well, no, but okay. So then let's think about this. Are you not going to focus on mental health because of that? Because the SDGs
Some groups might not. I'm surprised because WHO has put a big emphasis on the importance of mental health. And yes, we should assume it under health, but that's not the way it is right now. And I think that it will be neglected because it's not in there.
Well, so let me give you but I just want to, I don't want to let you off quite so easy on this if you'll allow me, please. So there are many things that are not included in the SDGs. The SDGs are not a perfect distillation of the tapestry of life, as David Nabarro calls it. The SDGs are a shorthand that got intergovernmental agreement where a variety of constituencies were able to find champions in the intergovernmental process for the things they cared about. That doesn't define life. That is a policy attempt on issues that could get, I'm just trying to explain this because you asked why it's not there. I'm saying because the mental health community, whoever it was, I didn't even realize it wasn't there, I actually thought it was. But the mental health community, oh, so the words are there. Oh yeah, so the words are there.
So
Doesn't, but my point is it doesn't matter. My point is it does not matter. If it's there, no, please, I feel like you're not listening because you don't like my answer. Okay. My suggestion is, I don't want you to be mad at me. I'm trying to be helpful is my point. If it's not there, let's find a way to get it there. So reproductive health wasn't in the MDGs, as an example. So the way to get the reproductive health in the MDGs was to get an intergovernmental agreement in the World Summit of September 2005 agreeing to a target for reproductive health. Then reproductive health was added to the MDGs. So these things are not permanent. But my second point, though, is even if that doesn't work, and getting the words in an intergovernmental agreement is just one very narrow part of a theory of change. The theory of change is, I'm working on this issue. I think that if we have an intergovernmental agreement, having those words will be a useful tool or a bludgeon or a wedge or something to open up the real processes that I care about. And there are many things where it might even be that the words, for whatever reason, are too political, too difficult to get, which is, there are many issues in the world where we won't get universal agreement, but many communities in the world will be able to choose to interpret the SDGs as meaning X for them.
That's true.
And if your city or your community or your school or your community of faith or what have you decides to take on an issue as part of its commitment to the Sustainable Development Goals, awesome, is my view. So this should never be seen as circumscribed by the text of some intergovernmental agreement. That is not the point. Those are tools, but even if you get those tools, that doesn't solve any problem. That just helps move towards a solution. And so all of these things need to be understood as very interactive. And we know that, for example, the goal for environmental sustainability made almost no difference. Why? So that's an interesting conversation.
Tom, were you going to say something?
I just want
And
to,
then we'll open it up.
I thought that was a powerful question that you asked us. What are the three most important actors? I just want to clarify, are you talking about the three most important people, the three most important institutions? What exactly do you mean by that?
I don't have anything in mind. I just want to know what's your theory of who needs to change or who needs to join in order to change what you want to change. I think if we
I can give you one or two, but anyway.
Yeah, this is an open time, so everybody chime in, because we only have 15 minutes, and we have some people who need to catch cabs and plane flights, so Jenny, you're next.
John, I agree with most of the things, but there is one thought looking toward the future. We still keep forgetting, and you did mention the role of technology and the way how we collaborate and how we manage systems. So if you look at the business side, people don't necessarily build big factories anymore and have big organizations. They use influencers and bloggers to make huge profits of whatever they sell, partly because people don't buy in the store, they buy online, or, it's a different way. So looking into education and youth, they are not necessarily, it's a unifying tool. Everything is interconnected. The way how they talk about global issues, and collaborate.
Who's
It's
they?
students. So kids who are, let's say, 10 today and will be 15 in 5 years' time. They are not going to meet necessarily going to conferences and having drinks together in order to run to someone who works on chemistry and I work on biology. They are already doing it online. We just don't tap into those conversations. There are very few of them, but there will be more of them. And I think that's going to influence also how we do problem solving. So it's not necessarily big institutions which are not fit for purpose right now. So I'm a big fan of the UN, WHO, and UNICEF, but within UNICEF, ECD doesn't talk to violence against children. So they don't even work horizontally. They are not interconnected, and they are not interconnected because the funds are not interconnected. The funds are siloed.
Thank you. I want to make a connection to whether or not something is or isn't in the SDGs. And goal 3, it talks about healthy lives, promoting well-being, and it gives a target of reducing by 1/3 premature mortality on non-communicable diseases to promote mental health and well-being. And it also addresses substance use, but there's no real targets. And I think one of the questions that we were put to here at this final is how do we build opportunities for collaborations across stakeholders and sectors that I think today's conversation is really it's reflection of that, of how do we find like issues that are cross-cutting with an individual or family. It's not unlikely that you're going to have a connection of mental health, illness, which is the word that didn't make it in here, if I remember the conversations, substance use. How do we build those collaborations for folks that they do understand the connection for the need for funding, for intervention, for measurement? I think sustainable development goals, how do we know when we reach that goal? We have to, I think, one of the gaps that I found in this discussion in the 2 days is there's not a lot of how do we know we're there? If we have a target, what does that target mean? And or just doing it, just promoting wellness, to me is not a target. I would like to find the folks that are interested in that holistic, that wellness, that substance use, that mental health community. I'd like to connect with those that are doing anti-violence work. I'd like to connect with those who are doing substance use and addiction work and figure out how we can really build those collaborations. And I'm not saying we have to do that right now or find those people, but that is a gap. And I think that's part of what our forum meeting is, to look at what do we know, what gaps exist, and how can we try to address them. So
One of the things, if I can
I don't think it's an
interject, just
answer, it's
that,
just a reality.
one of the things we don't capture here are the great conversations that occur during breaks and lunch and at breakfast before we start. And one of the ones that occurred today among a couple of us was for the future. We assume that practitioners know what cross-sector, cross-cultural collaboration means. What if we were to develop and provide to the schools of public health and the schools of criminal justice and the schools of social work and the schools of medicine a model course on cross-sector collaboration to teach people how to do it, to understand the culture of each other's sectors a little bit, so that I know what I'm dealing with if I'm an MD emergency room doc and I'm dealing with the police, I'm a public health doc fighting a disease in a community. I know how to mobilize the police to use their authority to get into homes, whatever it takes. So we talked about that briefly. We've gotten a little bit of that started at the Hopkins School of Public Health, but I was pushing that at lunch. And then I'll come right to you, Tom.
I mean, I think that that's very helpful. I will say, as I don't know, maybe one of the only people in this room who's not a PhD in anything, let alone anything useful, that the expectation that all practitioners are going to go and do a course in something, I think that's not necessarily the denominator that we want to be aiming for. When we're going for cross-sectoral understanding, it's really saying for someone who works with law enforcement or works with policy people, what should I understand about emergency room hospital data? Like, what does that tell me about a community? Like, I need, as someone who's going to go and hopefully fund policies or inform people of policies that they should be putting their money into, I need to be able to say, hey, you know what? It would be really valuable for your police department to have these specific indicators from the emergency room doctors, because that could help give them an idea of XYZ thing, or your educators to have that same information about how many kids are going into the hospital system for injuries that maybe never make it to the juvenile justice sector. So I think that there's a lot of things where when we say, you know, I do try to read the American evaluators things, the economics, the medical journals. However, I'm pretty smart and half of the stuff makes sense, and then a lot of it's just never goes into something that can reach a sort of a broader audience outside of that very rigorously trained research audience, and I think that that's a weakness. I did really like the idea when Jonathan was talking about what unit we're really being trained in when we think about each of these issues. And when you speak to people from the medical or the law enforcement or the policy community, we're not trained to talk in the same units. We look at institutions versus individuals versus the family versus, like, we're looking at very different things and ignoring the fact that they're all part of the same system. So I think that as a community, it behooves us to think about how much we can bring those things together to really get a better community model, not a community health model, but a better community model to understand how violence plays into that.
It's a great point. And by the way, my wife Robin would tell you what she thinks about the utility of a PhD. Tom?
Yeah. I think that unit of measurement is very powerful, and I think that's a great point. So I think, you know, in policing, you know, the fundamental challenge has been to get police to move away from their fundamental unit of measurement, being the arrest, to lives saved or to some other community measurement. And that's, you know, happening, you know, slowly in the United States and maybe faster in Europe, and, you know, and obviously we have challenges in other areas. But I just wanted to go to this concept of collaboration across sectors. So it seems very clear to me, especially because crime and violence are inherently multidisciplinary, perhaps more so than other issues, that the sort of walls between sectors and disciplines are clearly breaking down, and increasingly, at least in this space, I think it's fundamentally non-serious to just be familiar with the economics literature, just be familiar with the sociology, just be familiar with it as, you know, from your particular sector, because it's clear there's so many different things. And so the need for collaboration, and also the uniformity of research methods. I mean, I keep asking my colleagues at Harvard and other places, and I haven't really heard anyone push back. But an RCT is an RCT is an RCT, no matter whether an economist, you know, or a political scientist or whoever else does it. And at the end of the day, you know, I think that's sort of an interesting development. But so the need for collaboration and situational awareness is very clear. But then how do you get there? And after, you know, you know, being a founding member of a few White House working groups, running one White House anti-violence initiative, and then doing one for Governor Cuomo, all of which depended on this multi-sector thing. I have to say, it really, to me, is not about turf or culture or all of those things. Those are important issues, but it dwarfs capacity. And at the end of the day, we don't value collaboration. And so what happens is, if you're a busy person and you're working 10 or 12 hours a day, you're expected to collaborate basically on your own time. And when collaboration breaks down generally, it's not because someone has some ill will or they really, it's just, that next email was 20, to tell everybody what they were doing and so on and so forth. That's 20 minutes and they got to get back to see their kids. And so I sort of think that a fundamental sort of thing that we have to do is sort of reassess sort of what our workloads and work duties should be. And we have to go through all of our performance metrics. We basically have to say, we're going to measure everyone, including ourselves, and say, 10 to 15 or 20% or whatever it is for collaboration. You're going to be measured on that. You're going to be evaluated on that and all of those things. Because until that's built in, it's only going to be the most committed people who do this. And you can't, and this is, I think, an important thing just to be pragmatic, and then I'll shut up, is, real revolutions might be started by the most committed and most idealistic. But it's only when the average person who's only, when we make room for the less motivated, the less altruistic to sort of follow suit, where you get real change.
Before we take any more hands, just because we're coming up on 3 o'clock, how many of you have to catch flights? How many of you have cabs that are going to be waiting? Okay, so anybody that wants, we can hang out and talk forever, but we do have an obligation to get people out of here on time. Jackie, and then we'll take a couple quick comments.
I was really glad that John mentioned Indigenous peoples in Canada, and New Zealand is the other place that's done really good work on that. The United States and Australia, really lousy, at least in the traditional notions of Indigenous peoples. But I want to bring that to, first of all, your change in premiership really made a difference on that, because before that, like the lost women, the missing women, Indigenous women in Canada was a non-issue. Nobody wanted to take it up. It was only with new leadership that all of a sudden that became back on the agenda. And I think it brings up the issue, and I remember that those failed states are fragile states. And I know that a lot of them are in sub-Saharan Africa, in various parts of Africa, where we don't have even good data, let alone good ways to address, on all those maps, there's these big gaps in Africa. And I continue to be concerned about those widening inequalities that are so often between, it's not on the haves in terms of money, but it's also the haves in terms of respect, in terms of power, in terms, all of that kind of thing, in terms of how do we get them to care about the violence that's happening to marginalized people. And when we look at our rates of gender-based violence, ACEs, whatever we want to look at, our Indigenous peoples are always at the highest thing. And there's various endeavors, but it's very much siloed, and it's very much over here, and it's very much under-resourced. And talk about, in this country, the poorest of the poor. And I also worry about our inner cities too. But I think that is a huge challenge in terms of, besides enhancing a criminal justice response, how are we addressing the violence in those communities? And that, how do we get the powerful to care what's happening?
Thank you, Jackie. That's great. Now, let me do this. I'm going to close the formal part of the workshop and let you know that, first off, to say thank you to all of you. Special thanks to Louise and Francis and the team that put this together and made it run. Patrick left. I was going to ask him to make a quick closing comment. I want to let you know that the PowerPoints and the information will be available on the website shortly, and that a report of this session will be forthcoming. As always, it takes some months, so give us 4 or 6 months. We'll get it out, and ask your help for that as much as we need and can, and that we will continue the discussion. I happen to be one that has a cab waiting, so I'm going to slide out. But this has meant a lot to me, and as I think it was Peggy who said, someone said that I'm just spinning. I don't think there was a 5-minute span over the last 2.5 days, almost 3 days, where I wasn't hit with something new to think about. My brain, now this isn't a big deal if you know my brain is sore. And I thank you for that. That's an incredible thing to come away from any meeting with. So I'm going to excuse myself, and but keep going as long as you want. John, thank you. Oh, and let me make a commitment on John's behalf. He has to get out of here soon, too.
So can I just say one last thing to the forum members? So one, I just really want to thank John, who has spent his life the last 2 years traveling around, making sure this agenda is really what it is. And I think we don't just owe John, but our future 15-year-olds in 15 years, that this forum doesn't treat this Global Goals SDG forum as we did that. This should be integrated into everything this Global Forum does. If we do disarmament, we should think about it through this lens. If we do brain science, we should think about it through this lens. You talked about the journals that popped up, which ones, and the ones that showed progress, and how do we get to the first yard line. I think that there's a lot of stuff we can do outside our work, but as a group, as a committee, we should really commit to that for the perpetuity that this will be a new lens.
If I may build on that, I challenge the members of the forum to help me as the co-chair, and I don't have another co-chair yet, to take what you just said and use our forum as a catalyst to get what you just said into the agenda and the fiber of all the other forums throughout the national academies.